Do you actually need surgery for a meniscus tear? The truth is, most people don't. Research shows that non-surgical treatments often work just as well as surgery without the risks or long recovery time. Hey everyone, Dr. Jeff Peng here. I'm a sports medicine physician currently practicing in the San Francisco Bay Area, and over the years I've helped countless patients with meniscus tears get back to an active lifestyle. One of the biggest misconceptions that I hear is that surgery is always the answer, but that's simply not true. In this video, I'll walk you through 3 surprising reasons why you might be better off skipping surgery. Reason number 1. Non-surgical treatments work just as well as surgery. Now, when most people hear meniscus tear, their first thought is surgery. But research consistently shows that for the vast majority of tears, especially degenerative or age-related tears, non-surgical care works just as well. One of the most famous studies on this was published in the New England Journal of Medicine. They compared actual arthroscopic surgery to sham surgery, where patients were taken to the operating room, had incisions made, but the torn meniscus was not touched. The results were striking. Both groups improved the same amount. Surgery offered no added benefit over a placebo surgery. And that wasn't the only trial. Large randomized studies like the Meteor trial and the Escape trial also found that structured physical therapy produced outcomes equal to surgery in terms of pain relief, function, and quality of life even years later. And the reason for all of this is because the vast majority of meniscus tears don't actually prevent the knee from healing or functioning well. By strengthening the muscles around the knee, improving mobility, and gradually returning to activity, most people can restore stability and reduce pain without ever needing an operation. Reason number 2. Recovery is often faster and safer without surgery. Surgery often sounds like the fastest way to fix a meniscus tear, but the reality is very different. After an arthroscopic procedure, patients usually face weeks of restriction, sometimes even months, before they're back to full activity. There are also real risks: infections, blood clots, complications from anesthesia, and the possibility of persistent pain. Non-surgical care actually avoids all that. With physical therapy, exercises, and activity modification, maybe some injections, patients can usually continue moving right away, keep their strength, and make progress without the downtime that surgery requires. And here's the most important point. When surgeons remove part of the meniscus, it may actually accelerate arthritis in the knee. In fact, in a 5-year follow-up study of the original sham surgery trial, the researchers found no difference in pain or function between groups, but the patients who had surgery showed more progression of osteoarthritis on imaging. So by avoiding unnecessary surgery, you're not only recovering faster now, you're protecting your knee joint for the future. Reason number 3. Our toolbox of non-surgical options continues to grow. 10 or 20 years ago, the only real choices for a meniscus tear were rest, physical therapy, or surgery. But now we have more advanced non-surgical treatments that are changing what's possible. One option is platelet-rich plasma injections. And while PRP does not heal the meniscus tear itself, it can address the underlying osteoarthritis that often causes the pain in these patients. By improving the joint environment and reducing inflammation, PRP can help restore function and relieve symptoms without removing meniscus tissue or accelerating arthritis. Another exciting option is extracorporeal shockwave therapy. A recent trial showed that patients who received shockwave therapy had less T2 signal in the meniscus on MRI at 6 months, and this suggests an improvement in tissue quality. It's early evidence, but it shows how these newer modalities may support healing and symptom relief in ways that surgery simply can't. The takeaway here is that most meniscus tears don't need surgery. Physical therapy, exercise, and newer non-surgical treatments can get you back to doing what you love without the risks or downtime of an operation. But one treatment I only briefly mentioned here has been gaining a lot of attention, and that's shockwave therapy. So check out this next video where I break down exactly how shockwave therapy works, what the science really says, and how it could be the missing piece in your recovery plan.